Truth with Gwen Azama-Edwards on Goliath Radio.
Stan, you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, you got it, truth. No, knowledge is power. That was a test. Knowledge is power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access all of those resource listings with all powerful links that will get you to information that is what? Oh, powerful. You got it. You got it. You got it. Shout out to all of those who were survivors, the memory of all of those who were victims, all of those who were a part of the rescue unit, part of even the burial team, and my husband, Pastor Larry-Edwards, was a part of that at Ground Zero as well. But we just want to do a shout out to all of you and expressing our gratitude as we come a day after, of course, 9/11 and the infamous, unforgettable events of that time. And so we just are grateful to all of those who took the time to remember the event, to remember those who were involved on yesterday, lest we forget, and we should never forget 9/11 and what it meant to us as a nation. We should never forget either the reaction that came after that, which was a time of loving, caring, sharing, which we too quickly forgot. So let us remember that time and remember all the good unifying emotions that came about as a result of 9/11. On the website, www.gwen-truth.com, I also have the query that's continuing to ask you as the economy is improving, and all indications say that it is it improving for you in regards to your own personal experience, in regards to you personally, in terms of your life, in terms of your employment? Is it improving? As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach, author, minister, St. John Missionary Baptist Church Incorporated in Holland Hill. We invite you to come sometime. Community volunteer, an individual who, like you, wants to get the information that will ensure that I am able to make a lot of my own decisions. I am able to decide for myself what is best for me and what is best for my family and what's best for my community. So, website, www.gwen-truth.com. I'm very happy to introduce an individual who is our guest for tonight. We who are members of the Volusia County Women's Network had an opportunity to hear her speak on yesterday. And now you all have the opportunity of hearing her speak. She is, of course, Claudia Roth. She is the president of League of Women Voters of Volusia County. She, like the League, and I'm going to have her start off not just telling about herself, but also talking a little bit about the League of Women Voters as well. Because when they surveyed, and Claudia will remember some of the results of a survey that was done recently, several months back, but beginning of the year or end of last year, one of the things they found was that the men were more familiar with League of Women Voters, and it, of course, is not just our local organization of Volusia County, but there is a state organization, League of Women Voters of Florida, and there's a national organization, League of Women Voters of the USA, of the United States. So that you're a little familiar with what the organization is and is about, I'm going to ask her to cover that, in addition to an introduction about yourself. Claudia, welcome.
Hello, Gwen. Thank you for inviting me to be on your show, and I'm saying hello to your listeners. I can just let you know that the League of Women Voters of Volusia County is a grassroots organization. We are part of the state and national leagues. We are nonpartisan. We don't support political candidates or political parties. We do, however, study issues and we take positions on them. Gwen, would you like to know what our positions are on healthcare legislation?
Yes, yes.
Our national position is that we promote a healthcare system for the United States that provides access to a basic level of care for all U.S. residents and controls healthcare costs. And our state position is that we support implementation of the federal healthcare reform law in Florida, emphasizing access for all and cost control.
Wonderful. And so that individuals know, even though this is a League of Women Voters, they have men members as well, so it is open to men as well.
We've even had men presidents.
Yes, yes. I think Bob Coleman followed myself as president of the League of Women Voters for Volusia County. Welcome again, and so individuals know as well, and I will emphasize, nonpartisan organization. It is an organization that is made up of memberships of various parties, and it is an organization that seeks to gain or garner information through study and research, and then decisions are made as a result of that. And in that process, it is not something where you go with what somebody thinks, right? You go with what how the results of the studies indicate.
And more than that, it starts at the local level. It doesn't come from the United States League down to us. It goes from us to the United States League. And so that's why I emphasize that it is a grassroots organization.
Wonderful. And though we're going to get into the healthcare part of that, we'll get into the healthcare side of it, and that is what we're going to talk about tonight, the Patient Protection Affordable Affordable Care Act. And I make sure, I know they call it Obamacare, but that is the official name of the legislation. But though we're going to talk about that, I think it's a great opportunity and time to also mention, in terms of the state of Florida, the League of Women Voters of Florida, there is a legacy amendment that is petitions are being gathered for. Do you want to take just a moment just to mention that?
Yes, at our convention, the Natural Resources chairs asked for the League to adopt and participate in gathering petition signatures for the Water and Land Legacy Amendment. And what this means is that Florida has a history, we have it in the Constitution that we wanted Florida forever. But the Florida Forever has been defunded by the legislature, and so this amendment is to fund Florida Forever without raising taxes. So what it means is they would take a part of some fees that are already being collected, and it would just be a percentage of that, and it's also time limited. So I urge you to go to the Water and Land Legacy website and read the amendment for yourself, and a petition is available, and I urge you to take a look at it and to download it and to sign it and send it in to the Tallahassee address that's provided on the website.
And so that people know, as you know, this would be a citizens initiative, which means that a certain number of signatures, voter signatures, are required on the petitions, and that number is required in order to meet the standards that are set for an initiative to work its way through the system and through the process. And so the desire at this time is that you sign the petition if you are in agreement with the amendment and what it is attempting to do, which is basically a continuation of Florida Forever, so that something else gets in its place. And it's not additional money. In fact, it will be a certain percentage, not the entire thing of what's currently being set aside for Florida Forever, but it would be a certain amount of that. So you're not looking at new money, you're looking at continuation, a little bit of what is already going for land and waters, which will help safeguard those things being available for our young people.
And signing the petition, Gwen, only means that it would be on the ballot.
Right.
And to give the voters a choice. It doesn't mean that, signing the petition doesn't mean that this would happen.
Right, it automatically
just
happens,
means
right.
that it's on the ballot for voters to decide.
And that is truly key, because we in our democracy believe that people should have the right and the opportunity to decide as to whether or not certain legislation should go forward, certain protections, certain freedoms, certain rights, etc. And this does, as a result of were we to get enough, and my hope and desire and ours, of course, is that we do get enough signatures so that this can go forward and end up on a ballot for the voters to decide. You will have the choice. But unless if this does not happen, then you have no choice in terms of this legacy amendment. So for those who will go to even Port Orange Family Days and certain events like that, there will be petitioners there as well, so you have that opportunity to try to catch them. Okay, so we hope you will support that. Now, on to what's happening with health insurance in 2014. And Claudia, if you would share, again, with our listeners a little bit of your background, because your background is in nursing and is in the field of healthcare. And then let's get into sharing with our listeners what they can look forward to and what truly is important as it relates to Volusia County in terms of the Patient Protection and Affordable Care Act, what is commonly known as Obamacare.
Okay. As Gwen said, I do have a background in nursing. I have a degree in, a Bachelor of Science degree in nursing from the University of Texas at Austin. Also have I double majored in nutrition and nursing. I also have a master's degree in health communications. And that's the non-interesting part about what I'm going to say. I've worked overseas and in the United States, in the Midwest and the South. I'm just going to jump right in.
Okay.
Talk to you about Volusia County. There are almost 500,000 of us in Volusia County right now. The percentage of uninsured here has grown from 12% in 2002 to 25% this year. About 22% of us are over the age of 65, and we have health insurance through Medicare. About 17% of us are eligible for Medicaid or the Children's Health Insurance Program. The rest of us, 36%, have insurance either through our employers or the military, or we've purchased it on our own. Now, in 2014, for those of us on Medicare, the law has already eliminated cost sharing for annual wellness visits and cancer screenings, and it has already begun to close what is known as the donut hole, or coverage gap for prescription drugs. So right now, Medicare pays 21% of the price for generic drugs while you are in the coverage gap, and that is going to climb to 25% by the year 2020. So that's what I mean by gradually closing the donut hole when you're in the coverage gap for prescription drugs, Medicare Part D.
So those that are on Medicare have not lost anything in terms of what is coming forward for next year. They've gained.
They've gained.
In
yes.
terms of preventive care.
Right, because that means when you go to the doctor for your annual visit, you don't have to pay a copay, and you're not charged money that counts towards your annual deductible. So Medicare picks that up. And if you have a colonoscopy, or another kind of screening test, then Medicare picks that.
And if you are a female, not discriminating against the men, but if you are a female, then a lot of those things that we used to do or get done, like the mammograms and you know, those types of tests are now covered, so you don't have to pay the copay.
Screening
Part of it, yeah.
The screening mammogram is covered.
Mm-hmm.
Without a copay,
Mm-hmm.
or charge to your annual deductible.
Okay.
So next year, the law eliminates lifetime caps on health insurance plans. Other features of the law that were supposed to take effect have been delayed. The employer mandate has been delayed. There was supposed to be a cap on group plans of $6,000 for an individual and about $12,000 for a family, but that cap has been delayed for insurers and employers that use different companies to administer their medical and pharmaceutical benefits. Because if you have if you're going to try to calculate the out-of-pocket limit, and the pharmaceutical company that you hired, the way they calculate your out-of-pocket expenses doesn't talk to the company that you hired to calculate your medical expenses, then it's difficult for the employer to comply with the law.
Mm-hmm.
So they have another year to upgrade their systems so that can take place.
So these systems can talk to each other.
Right, exactly. Yeah, there was another cap that was supposed to have been imposed for people who follow the timeline. Remember, the law was passed in 2010, but different parts of the law are rolling out gradually. So for the timeline, there was supposed to have been a $2,000 cap for individuals and a $4,000 cap for families for small employer plans,
Mm-hmm.
for the deductible. But when you have an amount that's that small for a deductible, it raises the price of premiums. And small employers already pay about 18% more for health coverage for their employees than the larger employers do, because they don't have the leverage to negotiate like that.
Mm-hmm.
So what's going to happen is that at least for the next 3 years, and maybe permanently, federal regulators will allow the deductibles for small employer plans to exceed that $2,000 cap if there's no other way for them to deliver at least the bronze level of benefits and adhere to the law's affordability guidelines.
Mm.
So are your listeners familiar with the bronze and silver and gold platinum?
Probably not, because and in truth, the only thing that I'm familiar with is the gold. That's the top level, right? Where
No,
they
the platinum is
platinum
actually
is the top?
Yeah.
Oh, okay. Because basically what they talk about with that is that that's where a person is getting way beyond what they call the Cadillac, I guess.
Yeah, the Cadillac
version.
plans.
Right,
Mhm.
right. And that when they do that, and I was told that is the reason that some of the unions are upset, because they actually gave their members, in terms of health insurance that they provided it, something akin to that. And it means that when you have that, you pay more? I mean, explain.
Well, you just touched on the Cadillac plans and their relationship to the unions. When the unions go to the bargaining table, they sometimes the employer wasn't able or willing to raise wages.
Mm-hmm.
What they could do, though, was enhance their benefits.
Mm-hmm.
So that's how these health insurance plans came to be known as Cadillac plans, because the raises couldn't take place in wages, so the benefits would be enhanced, and they kept
Mm-hmm.
enhancing them and enhancing them and enhancing them to the point where some politicians have argued that it depresses wages.
Mm-hmm.
Because if you didn't have to pay these health insurance benefits, then raises actually take place
Saying
in
basically they
wages.
couldn't do both.
Right, so, part of the patient protection and affordable health care law does tax the Cadillac plan. That's different than these metal plans.
Oh, okay.
That's, those benefits are different. These are basic, this is basic health insurance coverage, but what the levels mean is that, there are 4 different levels of coverage depending upon how much the consumer wants to pay. A consumer with a bronze plan will pay lower monthly premiums, but would face a 40% share of cost. And if you compare that to the platinum plan, the consumer would only pay 10% of any costs that are incurred, but they would have a much higher monthly premium. The things that are covered in these plans are the same. It's just your level of cost sharing.
Oh, okay.
And the amount that you want to pay in premiums is different.
So with one of the two that you've mentioned, with one, if it costs $1,000, you would pay $400 and the plan would cover $600.
Right.
But with the other, with
You would pay
$1,000,
10.
you'd pay
10.
$100. You pay
Oh, right,
$100 and then they
100,
would pay $900.
Right.
So it's the out of pocket that, in terms of what you cover,
Right.
that is the difference in terms of the plans. Not with the coverage, because you're saying with the coverage,
Correct.
every plan has to have
It's
at
the
least
same.
a minimum.
It's
Yeah.
apples to apples.
Mhm.
The plans are the same.
Oh,
It's
okay.
just, you're going to be comparing apples to apples. It's just your amount of cost sharing and your
Mhm.
monthly premiums that is adjusted based upon your needs and based upon what you can afford.
So it's how much money you want to keep in your pocket as
Mhm.
opposed to the amount of money that the insurance company is keeping in their pocket.
Exactly.
Okay.
So there are some big things that are happening next year. What's known as guarantee issue is going to take place, and that means that insurance companies will not be able to deny coverage based on pre-existing conditions anymore. They must accept all comers. Carriers must charge men and women the same for premiums. They cannot use gender to base rates anymore. They can only use age, geographic location, tobacco use, and family size.
And in the past, from what we gather, women have been being
Well-
charged more.
Well, in the beginning, when you're young, when women were in their childbearing ages, we are charged more than the young men who are the same age. But when we get older, it reverses. Men who sometimes have more health problems than we do are charged more, and older women are charged less.
Wow.
So it sort of evened out if you live long enough. But that goes away after next year. They won't be able to charge different rates based on gender.
That's a good thing.
There will be an opportunity to purchase health insurance in the national marketplace. The federal government gave the states, they offered them grant money to establish their own exchanges. And you may be familiar that Massachusetts, of course, has its own exchange. California has an exchange, Minnesota has an exchange, Maryland and Colorado and many other states are setting up their own healthcare exchanges where people can go to shop for health insurance. Because Florida has elected to wait, Floridians will be able to shop for health insurance in the national marketplace. If you go to the website healthcare.gov, that is the portal where you can start to look at this now. The other thing that's important to mention about the marketplace is that the open enrollment begins on October 1st and it ends on March 31st. So we have 6 months to decide about health insurance. That time is going to get shorter after I mean, this year we get 6 months, but after 2014, that time for enrollment gets much shorter. Most of us must have health insurance or pay a penalty. And there are exceptions. If folks don't make enough money to file a tax return, then they are not required to pay that fine.
What is that standard by which you would know that, or do you need to go to the marketplace, healthcare.gov, in order to find out?
Yes, I think if you go to the website, healthcare.gov, it will walk you through the process of finding out if you are eligible to purchase health insurance in the national marketplace. Now, Florida has certified 11 carriers, that means 11 health insurance companies, to sell insurance to Floridians. And not all of those will be selling insurance to us in Volusia County. I believe six carriers will compete for your business on the website for Volusia County residents.
Now, a question may be coming to mind for our listeners. If you say they all cover the same, why should, if you've got 6, what is the difference and what will make the difference between your choosing one or the other if they all still are providing the same coverage?
Well, again, it goes back to how much you can afford in terms of how your premiums and how much out of pocket you can afford to pay. How it depends upon your health status or what you estimate.
So then what they will offer then is the metal, as you mentioned, the metal coverage plans.
Right, exactly.
Yeah, and will they all be offering all of the 4 levels, or will some be offering? Yes, okay. And so there won't be the opportunity to cherry pick, as we call it, where they just go after the better, which insurance companies have done in the past. This pretty much will eliminate that.
Right now, health insurance carriers are allowed to charge healthy people less money, lower premiums than 6 people for the same product. But next year, insurers will be required to consider as a single risk pool the claims experience of all enrollees in all of its individual market health plans in a state, and a similar rule will apply for small group market health insurers. And this single risk pool requirement is going to apply to all plans that are offered by an insurer in a market both inside and outside of the exchange. And premiums can be adjusted for geographic rating area in which the policy is sold. The states, the federal government allows the states to determine the geographic rating area. Right now, we have 67 geographic rating areas, 1 for each county. And you can go to the Office of Insurance Regulation website, and they have a search tool there that allows you to compare the rates that are charged in Volusia County and charged in other counties. So I assume that search tool will be available going forward.
Now, one of the things I heard you mention yesterday is that, and I think you mentioned it earlier, was that one of the things they will look at in our area and all of these 67 areas has to do with the smoke rate, tobacco, the use of tobacco.
The federal government allows carriers and employers to charge a 50% surcharge for folks who smoke. And depending upon whether the state allows the surcharge. California disallowed the surcharge, and Florida can allow carriers to charge the full surcharge, and that surcharge means 50% above the premium.
Wow.
Or they can modify it, or they can disallow it like California did.
Because we're seeing a lot of, I had Dr. Eaton on from Daytona State College. Of course, they've just made the requirement that they pass the non-smoking legislation. And there are other universities that are falling in line with that, employers who are doing something similar.
Yes.
Because not only is it healthier for people, but it also will save them in terms of their health care then.
If you go to countyhealthrankings.org, you can see that 25% of Volusia County smokes cigarettes. That's higher than the rest of the state. And yes, Volusia County has taken some initiatives to discourage people from smoking. The college campuses are going tobacco-free. The hospitals have already done this. And the housing authorities are moving toward making the campuses smoke-free as well. And there is help for folks who want to quit. Tobacco Free Florida, the website for Tobacco Free Florida, has a counselor that you can talk to. And there are products that might still be available to help you quit. They will send you a quit package.
And I think I saw something where as a part of those minimum requirements or things that are available through the health plan, one of those has to do with tobacco, something to help you if you have an issue with it or something? So, some kind of education plan or something similar?
I'm not sure.
We may get to that.
Okay. Yes, the campuses, the college campuses and the university campuses that are going tobacco-free do have information available to help the students and the faculty to quit tobacco.
Yeah.
Yeah.
And again, it's good for their health and it's also good in terms of the bottom line, finances.
Right.
Wonderful.
But it will be interesting to see what people decide to do. Are they going to pay the penalty so that they can continue to smoke, or will they quit tobacco so that they can afford the health insurance? So it will be interesting to see what people do.
Wonderful.
So we can talk a little bit about the essential benefits.
Yes.
Yeah, okay. So we mentioned the 4 levels of coverage, but what the law sought to do is to make it easier for consumers to make apples-to-apples comparisons when they're shopping for health insurance. And there are 10 categories of healthcare services that carriers must include in their products. Ambulatory patient services, and that means when patients are out of the hospital, like when you go to see the doctor. Emergency services, hospitalization, maternity and newborn care, mental health and substance abuse or use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices. So that's a big word, so let me just give you some examples. Rehabilitative services would be if you broke your arm and your arm is in a cast, but you might need some physical therapy after you get the cast off to regain the use of your arm. So rehabilitative services would be the physical therapy that you would get. Habilitative services would be, for example, if a baby is born with neurological problems, it would be, and they're delayed, they're not speaking as when they should be, they're not walking when they should be. It would be the physical therapy, the speech therapy, the occupational therapy that they would get in order to bring them further along and get them closer to their growth and development milestones. So I hope that explains that a little bit better. It would be laboratory services, so blood work that you would need, or urine testing, preventative and wellness services, and chronic disease management. So it would be the annual physical that you get. It would be the tobacco counseling. It would be chronic disease management. If you have asthma, is a chronic disease. Diabetes is a chronic disease. It would be high blood pressure, for example. Pediatric services, including oral and vision care. In other words, it would be dental care for your children and eyeglasses, to get your eyes checked. Particularly for somebody who has a chronic disease like diabetes, they need to have their vision checked more often.
Right.
So it would cover those things. So what happens is that the federal government allowed the Department of Health and Human Services left it up to the states to define what emergency services would be covered, what labs would be covered, what prescription drugs. So Florida had a choice. They could submit a benchmark plan, or they could allow the federal government to submit a plan. And Florida submitted a benchmark plan, and you can read it. It's available on the Office of Insurance Regulation website. And I encourage people to do this so that they know what it means when the plan says, well, we'll cover laboratory services. If you look at the benchmark plan and you see what Florida submitted under that category, it gives you an idea of what might be covered.
Because when they say laboratory services,
That
it may
could
not
mean,
include
right,
all
some
lab
of the
work.
things that you might
Right.
think it might. So just to be clear, and remember, this is going to vary from state to state because Florida's benchmark plan might be different from Georgia or some other state.
Okay.
And I hope I didn't confuse your listeners there.
No.
Okay, but it's very important to look at the Florida Office of Insurance Regulations website and to read that benchmark.
Now, one of the things you didn't expand upon somewhat, which had to do with the fact that Florida, of course, did not accept the Medicaid expansion, which would have added dollars to our area. I think you mentioned we missed out in Volusia County.
77 million, I believe, is. Of course, that's not that's not 77 million in 1 year. That's 77 million for the expansion of Medicaid, which would have been the match dollars that would have come to our county from Medicaid expansion. The Patient Protection Affordable Health Care Law assumed that the states would accept the match money to expand Medicaid. And the Supreme Court ruled that they didn't have to. And Florida has chosen not to expand Medicaid. The governor did support the expansion. The Senate had a plan to take the match money from the federal government and provide health insurance to the population that would have needed Medicaid expansion. But the House of Representatives would not agree to the Senate's proposal. In order for a law to pass, you have to have a bill in the House and a bill in the Senate, and they have to be similar in order for legislation to be sent to the governor's office for signature and passage. So if you don't have both houses, then and we didn't, then Medicaid was not expanded.
And one of the groups that this would have helped, which I was trying to share with our legislators, the Tallahassee before they made the vote, would have been what we commonly refer to as the working poor. Because they're not, the poor, truly as they define poor, already defined and included. The rich or those who are able to afford health insurance have their plans, but there is this group in there that they aren't poor enough, but yet they aren't.
Well, what happens? The unintended consequence, I think that you're referring to, is that if people don't make above the federal poverty level, then they are not eligible for the subsidies to purchase health insurance in the national marketplace. I think that's what you mean. I think it's less the working poor, because I think the working poor will probably qualify for subsidies in the national marketplace. I think it's more the population that I'm concerned about more are kids who are aging out of the children's health insurance program, and they're aging out of Medicaid. So they age out of Medicaid when they turn 21, they age out of the children's health insurance program when they turn 19. If they have asthma, then they don't have coverage for their prescription drugs anymore, their asthma medications. Now they can go to and get a Florida discount card for their medications, but they did have their medications covered when they were in the children's health insurance program. So now they're going to get deeply discounted medications for their asthma if they fill out the application for the Florida discount card, and that's available to any Florida resident. It's the Florida discount card is available, so they can do that, but they're going to have to pay more, and then they have to find a doctor to write that prescription. So that means that they have to go to the community clinics, or they have to go to the hospitals in the districts where they live, to the hospital taxing district, and they have to apply to have a doctor write their prescriptions for them there. So, but if they had health insurance, they could choose a doctor in their health insurance plan. So those are the folks that I'm worried about.
Now, would some of those not be able to be covered? Well, they would have to then be covered under their parents' health insurance, which would cover them to age 26, right? That's
provided that the health insurance is affordable. There are families whose employers do offer them health insurance, but to cover the family, it is just not affordable. But yes, if they can afford the coverage, they can stay on their parents' plan until age 26. Additionally, foster children are able to stay on Medicaid until age 26 through the Patient Protection Affordable Health Care Law.
And from what I gathered, and when I had another guest on talking about this too, there is no requirement that the employer provide the coverage for the children. They have to provide it for the adults, right? Let me say very quickly, commercial break. You're listening to Truth with Gwen Azama-Edwards. This is WLE, or BIG, Big, 1380 AM on your radio dial in Ormond Beach, Florida. My guest, of course, is Claudia Roth, who is the president of the League of Women Voters of Volusia County, and we're discussing the PPACA, which is the Patient Protection Affordable Care Act, commonly known as Obamacare, and talking about the implications as it relates to residents in Volusia County. It relates, of course, to all residents and all citizens throughout our nation, but we're talking specifically in terms of Volusia. And because we have listeners in Flagler, that a lot of what we're saying, probably good 90% plus, relates to you as well. In terms of the time to apply, you've mentioned that October 1 is the beginning time frame that people can go online and apply for the Affordable Care Act in order to sign up for the marketplace or get information in regards to that. And there are persons who have been trained, called navigators, as I recall.
Yes, navigators are paid to help people to enroll. They have to go through at least 20 hours of training, and they also have to be fingerprinted and go through a background check. That's a law that Florida passed that requires them to do that. But additionally, there is grant money for organizations like the United Way and hospitals and food banks and even faith-based organizations to become counselors to help people to enroll. Also, the Health and Human Services Department gave about $121,000 to the community health clinics on the west side to help get the word out and to hire people to help with enrollment.
Now, we know that there are a lot of people, especially those who are poor, in the lower echelon in terms of economics, who do not have computers or access to computers. How would they then get signed up? They would then have to go to the places where they can have access to computers and where the navigators are employed?
Yes, and that's why I say the hospitals will probably have folks that can help people to enroll, and I can't confirm that, but it's logical. And also some of the food banks may do this, and the community clinics on the west side certainly will. So they can go to the libraries and use the computers there. So there will be opportunities.
Now, one of the things, you had a question from our group on yesterday, and they were asking about the common fear among a lot of people, and which some skeptics are using as a way of scaring people away from signing up for this health insurance, that is too complicated, is totally confusing, there's absolutely no way people can work their way through it. And your answer had to do with the fact that when you sign up, they will actually tell you what kind of information you need to have prior to going through the process.
Right. Before you try to enroll, if you just visit this website, healthcare.gov, it explains what information you need to have before you sign up. Also, the employers are required by October 1st to give their employees information about the health insurance that they offer, if they offer health insurance. They're also required to give them information if they don't provide health insurance. There are 2 forms for employers to fill out. One is for employers that do provide health insurance, and the other is for employers that don't. Both of those forms are available from the Department of Labor website. So the employees are told by by the website healthcare.gov to get that information from their employer, and in addition to providing their social security number, there are a list of other things that they will need. They will need to know their income. So if you filed taxes last year, get out the last tax statement that you had from last year, because it's going to ask for you to estimate what your income is going to be. So there is a list of things for you to gather together before you enroll.
And so people know too, I mean, commonsensical, okay? The major reason they ask for these things is to make sure that you qualify. And
Right.
That's something that would be the case whatever you're signing up for, you know. If you signed up for Social Security, and of course those that are on Medicare, this is not, the marketplace is not something you can sign up for. You're not allowed to. You have to get the Medicare, okay? But for when you did sign up for your Social Security, you had to provide information, you know? You had to tell them what it was, and of course, because they talked to a lot of the other agencies, they could verify that. But whatever you sign up for, anywhere you go, you have to provide certain documentation in order to qualify, and this program is no different.
Right. The healthcare.gov, when you sign up to shop for health insurance on the national marketplace, it wants to know, first of all, if you're a citizen of the United States and eligible to shop for health insurance there. It's also going to want to know what your income is, because it wants to be able to provide subsidies or tax credits to you, depending upon your income. So if you're eligible for those, it wants to make sure that you get what you need to make insurance as affordable as possible. If, for example, your employer provides health insurance for you that is affordable, that is deemed to be affordable, then you don't qualify for subsidies. If you decide that you would rather purchase health insurance in the national marketplace, you can still do it. You can still purchase the health insurance, but you're going to have to pay full price.
And well, I guess there are times that a person might want to do that, especially if they're not planning to continue with that employer. Because
well, exactly, because
then
you
it
know,
would roll over.
if you, for example, have been working for someone and you have just are waiting for the opportunity to now freelance, or if you've lost or you're about to lose your job and you have to freelance, then the national marketplace is an opportunity for you to obtain health insurance.
Absolutely. There's a lot that we've covered, and I thank you so much for sharing a lot of this information. As people can see, there's a lot to it. In my opinion, it's not all that complicated as much as people are trying to tell you it's complicated. But this is an opportunity for people, again, who were and are uninsured to get insurance, to get coverage. Because, as I always say, Claudia, a healthy person, you know, leads to a healthier family, and which leads to a healthier community, which leads to a healthier nation. And the healthier we are, the more productive we are. And for those employers who get so concerned about, don't want to cover, you know, their employees, et cetera, et cetera, et cetera, and I know it gets to the bottom line. But the other bottom line is that the healthier your employees are, the more productive they are, and the more money and income you get. So, I mean, to me, that's real simple and real basic. Perhaps I'm oversimplifying, but that's the bottom line to me, that we want to be healthy and we want those around us to be healthy. We're all breathing the same air. And we want to make sure that people have the opportunity. It's about access in many ways, right?
Well, it is about access to care, but even with health insurance, even if you have health insurance, you need to be able to understand how to be healthy. Or if you have, if something happens to you and you are sick, you need to understand the treatment plan, and you need to understand your options. One of the things that we need is transparency. We need to know what options are available to us. We need to know the risks as well as the benefits. So whatever kind of health system we have, our ability to find information and to understand it is going to be key. And while the Patient Protection and Affordable Health Care Law did not mandate anything specific to health literacy, which is our ability to find and understand health information, there is language in the law that does promote accurate and accessible health and safety information. It also supports the National Action Plan to improve health literacy. There are 7 goals to improve health literacy in that plan. The law also supports the Plain Writing Act of 2010, which promotes clear communication between you and your provider, your healthcare provider. It also supports the Healthy People 2020, which measures health literacy improvements by healthcare providers. So the Patient Protection Affordable Health Care Law did more than change health insurance products.
And as a person who's familiar with an individual who worked for a fairly large employer and paid into her health care insurance for years thinking she had certain coverage, and ended up in the hospital and was told as of that time that it did not cover certain things that she expected it would cover. This would make it rather plain that in terms of what's covered, but also ensure that there is a certain basic foundation of coverage for everyone.
Well, what your story points out something very important. It's going to be very important for people to be able to get help when they are signing up for the health insurance.
Mm-hmm.
Because there are the 4 options, and they have to understand what's in the benchmark plan. And the reason I say that is because there are so many parts of insurance that people need to understand. They need to understand what prescription drug tiers are. In other words, just because a plan covers prescriptions doesn't mean that the drug that you need is going to be part of the tier.
Mm-hmm.
And it also means that you have to, just because you can go to the doctor now that you have health insurance, you have to go to the doctor in the network of the plan that you purchased.
Mm-hmm.
There is a lot for people to understand. They have to understand co-pays. That's the amount of money you have to go to pay when you see the doctor, unless it's for your annual physical.
Mm-hmm.
And I'll give you an example. I know a young man whose baby was born with a health problem, and the baby qualified for Medicaid, even though Dad was working and had health insurance. Dad thought that he was doing a good thing by buying health insurance from his company. What he didn't understand was that the copay for specialty care, in other words, the copay for the specialist that his baby needed to see, was going to be $65 for every visit. Under Medicaid, he didn't have a copay.
Mm-hmm.
So even though he qualified, and he didn't understand, he didn't understand the health insurance that he was buying.
Mm-hmm.
And that's why I say that the navigators are going to be important, the counselors are going to be important, and people will have access to someone they can call. There's a number that they can call if they are stuck in the process of applying for health insurance through the national marketplace, and they can also get help online.
Mm-hmm.
So, additionally, I want to point out that the healthcare.gov has information about what you need to do to protect your privacy, what you need to do to protect your Social Security number. They have very important information there about who you should talk to and who you shouldn't. There are going to be predators out there who are going to misrepresent themselves to you in order to try to get your money or your personal information.
Mm-hmm.
Healthcare.gov has important information for you so that you can protect your privacy.
And as you were talking about this, it reminds me so much of Medicare and what people are doing, those that are new to it, that are signing up for it, because the time that you're able to sign up for that is 3 months before your birthday and 3 months after, the 6-month period. In addition, there are, I don't know if they call them tiers, but there are certain qualities of care that you can either take out. You can go with the original, Medicare, or you can go with an Advantage program or whatever. And there are different things that you can get as a result of that, depending upon what you sign up for.
Mm-hmm.
So in terms of health care, as I said on yesterday at our meeting, health care is it's a complicated system in terms of the fact that many times people just don't know. And you can be the brainiest person in the world and still not, when it comes to health care, which is a very, very personal decision and personal matter in terms of what it is not only that you want, but you can afford, et cetera, et cetera, et cetera. It can be something where, if you were dealing with another subject, you could probably decide something just like that. But in terms of this, as it relates to you and your family and personal care, it's good to have someone else that you can talk to who can help you to navigate through the system, through the process, and understand what is ending up to be in your best interest in terms of you, in terms of your family, and the like. I also said, and I believe, as with any new legislation, as with any new system, there are kinks in it from the beginning, because when you're dealing with people, there's always going to be something that you never really saw as a side effect, an unintended consequence. And as you get into something, those things start to reveal themselves. So I believe as more people, as they start to sign up, and we really encourage Legal Women Voters, U.S., Florida, our organization locally, encourages everyone who is without insurance to go to the website, to go to a location where you can have access to the information, to check to see, number one, if you qualify, number two, what it takes in terms of the materials and signing up and the like. Do that, because that's key and important. And I believe the number in terms of uninsured, what was the number that you gave for our county? There's a number for our county, but I believe for our state it's around 3 million.
I believe it's around 3 million for the state. I just want to point out that about 48,000 Volusia County residents will be eligible for a tax credit or health insurance subsidies, and that information is from Families USA. So about 48,000 of us, can get assistance to afford health insurance through the national marketplace.
And for those who, that's what the subsidy is. It is assistance that will be provided, which will lower the cost for you for the insurance through the marketplace.
Well, there are actually two mechanisms. There's the subsidy, and then there's the tax credit. The tax credit is available for people over a certain percentage of the federal poverty level. The subsidies are available for folks who earn between 100 and 250% of the federal poverty level, to help them afford the co-pays and the deductibles. So, and as they go through, as they go through that, the signing up though, it will let them know what they. So you don't have to say, well, okay, but it isn't interchangeable. It isn't either tax credit or subsidy.
It's whatever you qualify for.
It depends upon what you qualify for.
Okay, well, I've said before, I will say it again. I'm excited about this opportunity for people who are uninsured and probably in an indirect or direct way underinsured, who really have a health care need, to really be able to meet that need through the Affordable Care Act. And the fact that there will be people who will be available to assist. Again, that time that you can sign up for, though you can go to the website now to get information to see.
Yes, you can go to the website now and check it out. If you sign up for health insurance on October 1st, it won't take effect until January 1st of 2014, but you can certainly enroll.
Okay, wonderful. So please, and that's healthcare.gov, healthcare.gov. And you can go, if you don't have a computer, go to your local library or agencies that are available that will provide you with free access to a computer. You can go get the information, or you can go to one of the organizations that has been contracted with, provide the navigators to assist you. And they are out there.
Or you can call the 1-800
number where you can find out as well. And as Claudia has said, it's just like when you reach the age like myself, as you get closer to 65 and you start getting all this information from all kinds of people who want you to sign up for this and want you to sign up for that, because they know that you will be making that kind of a decision. The same thing is true in terms of your health care, in terms of the marketplace and related. There are all kinds of people who will be contacting the 40-some thousand people eligible for the program in Volusia County, and they're gearing up and they're ready to hit the ground running in terms of trying to get you to sign up for something which may or may not be in your best interest. So go to healthcare.gov, go to the agencies that have been qualified and certified to assist you, and do your due diligence. Anything else you'd like to add, Claudia?
I just want to remind the employers that they can go to the Department of Labor website to get the forms that they, to get information about what they have to provide to their employees about the national marketplace.
Wonderful. And you know, the one thing that we didn't cover, you alluded to it, and that's the if you don't get coverage by 2014, you do have to pay a fee. And that fee increases. It starts at $95 for the adult.
It's $95 the first year, or 1% of your income, whichever is greater. So it could
That's when
be
people
greater
forget.
than $95.
Right,
It
right.
might be
1% of your income, or $95, and whichever is greater. So it may not be in your best interest to actually not sign up and get insured. Okay. Again, you can start signing up as of October 1. You have through March 31, but don't wait. Don't wait. Final comments.
If people don't sign up by March 31st, then their next opportunity won't be until the next enrollment period. So if they have an accident or they get sick and don't have the health insurance, they won't be able to sign up after the fact.
Okay, well, my thanks to Claudia Roth, again, President of the League of Women Voters of Volusia County. Men can be members too. Many thanks to you for coming on and sharing this great information in terms of healthcare. I will have other guests who will be coming on as well, because it is an important issue. It's an important opportunity for those who are uninsured. Again, be sure to join us every Thursday starting at 6:15 or whenever we boot the big guy out of the chair or he gets up, as we discuss issues to inform and empower our listeners. Also, be sure to go to the website www.gwen-truth.com, where you can actually link on to League of Women Voters of Volusia County, their website, because I have websites for governmental advocacy groups, etc. That's on my website at www.gwen-truth.com. And when you link onto that, you can actually get directly to healthcare.
I don't know that we're linked to it.
Yes, we have it on our website. We have a link there for them. Yeah, we do.
That's good to know.
Yes, that is good to know. So you can do that. I would think I also have the federal agencies, etc., as a part of that too, for your information. So please go there. And this video will be uploaded also, so that you can access it by going to the website in a matter of a few days. So please, whether you need it or somebody you know needs this information, needs to sign up, please make sure that it happens. Again, until next time, be informed, be empowered, stand tall for that which is right and truthful. Again, this is Truth with Gwen Azama-Edwards, my guest Claudia Roth, and we, like you, we're still standing. You be blessed and have a great week.
Your host, Gwen Azama-Edwards, exclusively every Thursday night on WELE 1390
I know
Radio.